morning, students. Myself Dr. Farzana Butool, and my channel's name is Learn Biology with Dr. Butool. I am dealing with the lectures of human health and diseases, and my last lecture was on cancer disease. And I have discussed about the definition of the cancer, the types of tumor which are formed due to the disease of cancer, and metastasis term was described in elaborative way. Then I have discussed about the carcinogens, and they are of three types, that is biological carcinogens and chemical and physical carcinogens. Now I am going to discuss about the diagnosis, detection and cancer. The cancer disease, as you all know, that it is the uncontrolled division of the cells and repeated division of cells which form the tumors of different types. One is malignant and the other is non-malignant. About this I have told you about the different type of carcinomas, sarcomas and leukemia. This is blood cancer. And the detection of this disease is very important, and nowadays there are so many techniques which are helpful in detecting this disease. And the first one, as I have written on the board also, the first one is by biopsy and histopathological studies by the doctors or by scientists. Biopsy, it is a part of the cancer tissue which is cut off from the body of the patient from that organ from the cancer is detected, and it is stained, the tissue is stained in different under different stains, and it is studied histopathologically in high range microscopes. This disease, this technique confirms the presence of cancer in the patient body. And there are other techniques which has been written in details on the board, and the first is by radiotherapy. Here the X-rays are used by the doctors to detect the cancer in any body part. The second technique is CT technique. This is computed tomography. This technique is also used for detection of the cancer. And the third is pap smear test. This is very common cancer, that is cervix cancer or uterus cancer in females. And this test is performed to check the presence of cancer in the uterus of females if they are giving any signal of, any type of signal of cancer in their body. And after the technique, this is the treatment. First, we should understand that there is no 100% proved technique so far in the entire world to control this disease. And the main, as we are discussing about different techniques and then the treatment, and the goal is to prolong the life of the cancer patient or to improve the quality of the life, because so far in entire world there is no 100% treatment for the cure of this disease in human beings. And there is one more technique which is used for the detection of cancer, that is MRI, that is magnetic resonance images formation, and these are used for detecting the cancer in internal organs, that is radiotherapy, computed tomography, magnetic resonance imaging, and these three techniques are mainly used for detecting the cancer in internal body parts. And I have told you the goal of treatment, that is to prolong the life of the cancer patient and to improve the quality of the life of cancer patient. And here there are the methods of treatment which are used in entire world for curing the patients, for treating the patients of cancer. The first is radiotherapy. Here the tumor cells are killed or they are irradiated lethally by radio rays, so that the patient feels some relief. The other one is chemotherapy. It is very common but very painful technique. Here the chemical drugs are used to kill the tumor cells in the body of the patient, and the side effects are very pronounced in this treatment, that is the hair loss and anemia. And the patient goes many rounds of this chemotherapy sessions. The third one is surgery. If the cancer is any part of the body and it can be removed by surgery. So it has been seen that about 80% cancers reoccur after some years or after some months, but it is also a method, and most of the cancers are treated by combination of surgery plus chemotherapy plus radiotherapy. So students and my subscribers, these are the detection and diagnosis and treatment of cancer disease. And now I am ending this lecture. This is the second lecture of cancer disease, and in row it is my 7th lecture. Kindly go through my lecture, like and subscribe. Thank you.